We acquired 15 units to start with, and that was around April 2018. Where are we now in the autumn of 21 is that all of our residential and nursing homes have access to RITA. We had around 49 units as part of our pilot and next steps. And then what we were able to do through the pandemic was invest in 100 iPads, the smaller RITA units.
RITA for us is a lifesaver, really. So it's an interactive system that we use for many different purposes, from enhancing the quality of life of residents, to managing behaviour, to reducing falls. It can get groups of people together and to have more conversation and build relationships. It can manage individual behaviour.
I think the benefit of RITA is that it comes preloaded with content. It doesn't mean then you've got to connect to the internet, you've got to search the content, the appropriate content. It's there, it's immediate, so that care team can actually get RITA, touch screen, and take them straight through the content that they're looking for.
You can set for each individual what kind of activities that they like, so what works with somebody. So instead of searching through RITA, it's already preloaded, it's already got that information on there, so you can literally just wheel it in, and you know you haven't got to find something that interests that person. So if you've done that bit of background beforehand, you can set their favourite music, you can set their favourite activities to that individual person and just click on that person. We had one lady who was really quite agitated. We knew she liked synchronised swimming. We'd not used RITA with her before. We managed to get some synchronised swimming up on RITA. So instead of sitting there shouting, she was engaged. She was telling us about the synchronised swimming that she used to do. And who'd have thought that, you know, where else can you just click on something and just find something like that? We've got a couple of residents who are not eating very well. So we've got them together just before lunchtime to use RITA to do an activity on food. So all they're thinking about is food. Then when it comes to lunchtime, they've eaten a little bit better. You have times in a care home where it is quite busy. And then you have residents who can get quite agitated as they see people coming and going, and it's about keeping people occupied so that the staff can get on sometimes and do other things. So it's about using the system to alleviate some of that pressure. We've got a gentleman, for example, who gets really agitated, but we can sit him somewhere, put RITA right by him, put his favourite football team on, and a match, and he's quite happy and quite content. You don't have to do that one-to-one interaction. RITA's doing that for you, and it reduces the amount of staff interaction. We've got one gentleman who used to be seemed quite down and quite low in mood, but puts, you know, the old Dad's Army on RITA, and sit there, and he'll watch those clips, and he's laughing and he's totally engaged, and that's taking no staff time. So that staff time can be used with somebody else. We've got somebody who walks about a lot and tires themselves out, then they're more prone to falls. So even if we can get them to sit and rest for a short period, which is really difficult, but if we use RITA, we can get them to sit and rest, and then that will reduce falls, reduce them going off into other people's rooms. So throughout the day, if we use that for short periods with a particular person, we know that they're sitting down, having a rest, having a drink, interacting with RITA.
So we wanted to look at how we could support the market to actually support people with differing needs and potentially more challenging needs. Within Dudley, we've got a standard placement rate, and what we were finding was that the providers across that residential and nursing home market were asking for additional costs. So whether that was an additional one-to-one cost to support someone with challenging behaviour, or if someone with dementia, in terms of being placed in a residential home, they were asking for higher costs, that higher than our standard rates. So what we wanted to do was explore the use of RITA that could support those care teams to understand the person better and to provide care in a more engaging way. So what we wanted to do in terms of the pilot is we wanted to work with those residential and nursing homes who were interested, who didn't want to just put the one-to-one support in, who didn't want to just say this is the cost of a high placement cost to support someone with dementia. We wanted those providers to use RITA as a tool and to give us some real feedback in terms of the difference it's made. We also wanted to look at the added benefits of working in a day opportunities organisation, and also with informal carers. What difference would it make to them to carry on caring for their loved one with dementia or challenging behaviour? For the first 15 units, we invested £75,000. What we did is we used some monies from the Better Care Fund because we felt as a system we didn't want it just to be across within adult social care, but we also worked with a home that the clinical commissioning group identified where there'd been a high number of hospital admissions. That's where we took the prime funding from. And after around 13 weeks of the initial pilot, we then invested the same amount again because the benefits that were coming back, we felt it was something that we needed to do. So we worked through a business case around the evaluations and took that back to our management team to get further investment. And then the pandemic. But what the impact of the pandemic allowed us to do was use some of the infection control monies. And we were actually able to get the small RITAs, the iPads, in every home in Dudley that hadn't got the use of other RITAs. With regard to the evaluation, we built a pro-forma to gather the evidence of the difference it had made. Homes have to report the number of falls that have happened in the home each month, hospital admissions. So we wanted them to use that baseline data to actually document what difference it had made. So we pulled all those results together and we analysed it all in terms of some of the outcomes that had been achieved through the use of RITA. What that included was a reduction in falls. It included a reduction on one-to-one safeguarding incidents. It included a reduction of hospital admissions. It demonstrated an improvement in the quality of life. So informal carers also told us that they were able to have meaningful conversations with their loved ones through the use of RITA, where often they struggled as well. A couple of the homes said when somebody's situation, their condition deteriorated, so it may be dementia, where they become more challenging, a person becomes more challenging, they were able to accommodate those changing needs in the same unit instead of saying, can we have this person reassessed because we can no longer manage that person's changing needs. So we were able to pull that in as part of the evaluation. In terms of New Bradley Hall, which was one of the homes that we worked with, they were able to accommodate a person with changing needs as part of the pilot. So the person was in a very high cost placement because of their needs. And what they did through the use of RITA was support that person to move into New Bradley Hall. And what they could do with RITA and a number of other tools within their toolbox, because RITA is just one, was able to accommodate that person's needs at the standard rate. That wasn't an isolated incident. They were then able to accommodate another 2-3 people with this in a very similar situation, not the same because everyone's different, but in a similar situation again, where they could accommodate someone with those intense needs, if you like, at the standard rate. In terms of sustainability, we're going to start to work with the market again to see what they need with regard to RITA. The discussions we've started with the providers across the market around sort of the funding options is because, they provide a mixed economy of care. They provide support to self-funders, and they also have placements where the local authority fund the placements. Homes that, majority of their economy self-funders, they've looked at RITA and provided feedback to us that they would be expecting the person to actually purchase RITA, if they felt that it was going to make a difference in terms of their care and their quality of life, that they would sort of promote the use of RITA. So there's different options regarding funding, and I think what we want to do with our provider market is explore that. Could it be a home with 2 floors that we fund one of the units and then they work in partnership and fund another, so all the floors are covered in the home? Or is it that, it's a smaller home, so we put 50% each, and when the funding that comes back, we can then reinvest across the whole of the market? And we're going to start to have those conversations again.